I think there's a lot of components to running a good department. I think one of them is that you have to really care for your people.
You know, we love technology, that's why we're here in this field, and so they are constantly pushing that envelope, so it allows us to remain current and, you know, right there on the leading edge of technology.
And they have a true passion for what they do, whether good or bad. It's a phenomenal trait for theirs, and they have a passion to understand exactly what is going on.
We started at 15, we're at 40 now, and we've also grown in that we're doing CEIT also, we're doing medical device integration. In biomed, we're now at 15 staff. We've got imaging, we're at 4, and then we do have an administrative staff of 3 people. We have our own call center.
Clinical engineering here at North Shore is responsible for maintaining our clinical equipment and making sure that our equipment is functioning at optimal levels.
So we do have really good structure, and we do work with everybody to try to grow them personally in their career.
This has been one of the most educational and fun environments I've ever worked in before.
And our team is more so just very committed to growing professionally themselves. In 2011, nobody here at Evanston was certified with the Certified Biomedical Equipment Technician certification. And this is a voluntary certification. We didn't twist anybody's arm. And now there's 8 technicians that are certified.
Today I'm standing in what we refer to as Darlene's Wonderland. This is where all the devices that we need to test and troubleshoot, we can come here and see what's going to work, what's not going to work.
So by having the ability to do that here in the shop area has greatly improved our results. I can't really quantify it, I just know that it's a much better environment for the clinical staff, our staff, and the patients themselves.
Well, I think our work with the alarm committee was probably the most challenging.
The Critical Alarms Project is a prime example where a team of us identified a problem with alarm fatigue.
What this project did was get rid of all the white noise with unnecessary alarms.
So a team of us got together, including cardiologists, our quality team, as well as our colleagues from clinical engineering, to explore ways to identify all the different alarms and see what we could do.
From a safety standpoint and what our mission is to try to keep the hospital safe, I think it's been the most gratifying thing that we did, because we know that the hospital is safer now.
Each monitor at the bedside had to be reconfigured and reprogrammed with the recommended changes by the alarm committee.
So then we were able to decrease the number of alarms that were being paged out to nursing. So here at Evanston alone, we were able to drop the alarm count by 80%.
So it took a lot of collaboration, a lot of organization and teamwork.
Medical device integration, for example, is another area that we're working. We spent the last year working with anesthesia and HIT, going through all the different areas of anesthesia and getting those devices integrated.
We had to integrate over 150 devices with about 55 variables in our 4 operating rooms. We had to work closely with Mike and Darlene to first identify all of those devices that we wanted to integrate, find the model numbers, the serial numbers, map all these devices, and then they were shoulder to shoulder with us testing every device 3-4 times before we actually went live.
The opportunities that we've had to learn new products and be brought in on projects like this has just been tremendous, and we have such a fun environment here and we enjoy working with each other. It's not necessarily a job per se, it's a career.
To me, we're one team. We're the Health Information Technology team, and we have our clinical engineering folks who are side by side, and it really is a true partnership that we have here. You don't realize that we work for 2 different employees. We're really one team.
The clinical engineering team, which is one segment of the broader Aramark relationship that we have here in North Shore, really has done a great job of becoming part of the family.
The team here with the Aramark employees and working in conjunction with North Shore has just been a great partnership.
Oh, it's a huge difference when Aramark came on board, because previously, depending on the equipment and how far the technical training went, a lot of times we were on contract for repair, and that meant there was a phone call given to the company, and it could take days.
And so whenever they have a plan or an idea, we're able to collaborate nicely right next to them, and the flexibility that our program delivers is just great to be able to work alongside a client that is so dynamic and constantly changing.
They really want it to be as seamless as possible. And so I feel like I'm a member of the hospital, I'm a member of the hospital staff.
We don't really think of clinical engineering as part of Aramark. We think of them as part of the North Shore family.
When I walk into the hospital every day, that's what I think of. What can we do to make patient care? What can I do to make my team better to take care of the patient every day? That's our challenge. The team I have now that we've built, the level of teamwork that everybody displays, and it's true felt, I think is probably the most outstanding thing that I've been able to be a part of, and I'm just proud to be part of this team.